thanks for asking that question. And I think that, you know, if we have first responders in the audience, which I'm sure we have many, ask them candidly what their first priority is in their work. It's to save lives, right? It's to get people home safe. It's to make sure that if someone's in danger, they can be rescued. It's to make sure that people know that the government's going to be there to get them through very dangerous times. So at an everyday level, it's kind of conflated with the end of law enforcement. We use laws to enact those rescues and you know, get people home. And it was a lot of times with imperfect results. But I think what's really interesting is that, you know, you have this real recognition of what pain when they're pursued at the same time, because, you know, a lot of times police are party to people in danger, domestic violence, things like robbery, things like shootings. But now the very thing that's placing people in danger in public and correctional settings is something that can affect the police just as easily as well. So, and also correction staff. So what we're seeing now is the dangers that the government has to rescue people from are dangers that can easily affect the very first responders that are performing the rescue. What that means, again, you know, as far as corrections and policing goes, is that we have to really, really, really prioritize our and for public safety. And what we're seeing now is a reconsideration of what that means in practice. And what we're finding is, apropos of that op-ed, a lot of the people who are being held in for, you know, a retributive reason to fulfill a sentence are being let go of. And I think we're seeing a good balancing then between public health and public safety. So the question is, are we doing enough of that to stop the spread of the virus? And then once we're past this pandemic, will it cause us to reassess our sensibilities about public health and public safety overall and in a lasting way?
Great, thank you. And talk a little bit about kind of the particular importance of reducing custodial arrests at this time, given what you just said.
Yeah, right. I mean, if you look at, I mean, and I guess everybody gets this by now, but flattening the curve is not about the total volume of cases. It's about the rate at which those cases present. So they present at a rate that the healthcare apparatus can deliver the proper resources and doesn't get overwhelmed. And the rate at which they spread is determined by physical contact, right? I mean, one of the things that police officers and first responders take pride in is saying we're the men and women out in society who aren't afraid to come into contact with some of the most difficult people in our communities, meaning, you know, people committing acts of violence, people who are not social cooperators. And we have to remember, right, that this contact is exactly what spreads this disease. So if the stakes are low, right, if it's a misdemeanor, if it's traffic enforcement that doesn't directly bear on traffic safety, if it's things like maybe petty theft or minor vandalism, you know, we really have to balance then what custodial arrests do as far as accelerating the risk of spreading this virus. The very thing that distinguishes policing from other forms of behavioral interventions is contact. And that contact is the most dangerous thing when it comes to a peaked curve. So I think that we have a reckoning with COVID about how much contact we want to have with people, and that affects custodial arrests.
Thank you. Chief Brackney, I'm going to move on to you to hear a little bit about some of the things that are going on the ground in Charlottesville. Can you tell us how the Charlottesville Police Department has been responding to the pandemic and kind of what strategies or protocols you're using right now?
So thank you for having us in this very important conversation. So the strategy we're using is following along our motto here is that we are balancing public safety with public health. So for the first time, we are aligning public health and public safety and that they're not separable at this point. In fact, they're inseparable. We talk a lot about building what does community health and community safety look like. And normally, as Chief Del Pozo just said, that we typically think about that in terms of laws, but now we're having to think about this in terms of concepts, that public health and public safety are not constricted or constricted by laws. They are now just part of how we interact. So as a matter of fact, back in March 25th, we urged our governor here, Governor Northam, to take very strict a stance on what does social distancing and safety look like. Persons who have to be out in the community, but for the first time to look at it from a first responders point of view, and then how do we protect our first responders. So here, Charlottesville has led the format for the Commonwealth of Virginia on how we interact. And the first thing that we did is we designated changing our interactions and what could we reduce in terms of having to interact with the public. So we put an online presence and a telephone reporting presence that most places don't have anymore, right? Because it's antithetical to community policing, that we want to engage with the community. So we had to take some very harsh steps. We had to work with our ECC and our dispatch to say that we would no longer be responding to certain types of calls, that we were asking the community now to police themselves. But if we had to respond, that there would be a way that we would do it that had an educational component first, that we are encouraging people to stay at home so that we can continue to come to work. The first thing that we are doing is if we get any calls that are in violations of stay-at-home orders, or if they're those low-level non-violent crimes, we're doing all of those online. You can now have a non-emergency number that is a dedicated 24-hour number that answers all of the calls that if you're not sure, we'll screen them for you and then still have the ability to dispatch if we need to. We are doing a lot of things over our PA systems so that we don't introduce ourselves to groups that may expose our officers. We're sending out messaging that our officers will be in personal protective equipment at all times. Part of our narrative that we are giving out either through telephone conversations is if we have people who are in violation of stay-at-home orders or low-level types of crimes, we are now calling those places and notifying them that they are the subject of an investigation. So for the first time, we're having to do a lot of that via phone. If there are these violations, particularly of these stay-at-home orders, and I know there's this balance between constitutionality and what these mean, we're telling them, we're notifying the health department that people are in violation, right? So that we can bring that portion of it under control. But then we're also doing things like notifying our Commonwealth's attorneys that we may have to send citations. We're not doing traffic stops the way we used to. They're just high-risk traffic stops only, and which we're then asking our individuals to show us their driver's license, and we will take a photo of that, go back to our car, and then do the information, and then possibly send the summons via the mail, so that we stop the connection very early and very quickly.
Thank you. So clearly lots of strategies, and I'm curious how these will play out over time and kind of what changes may stick in the future. I'm also curious, we've been talking a lot on our team about how police agencies are leveraging partnerships with other community groups or agencies to better serve the community as well as officers. Can you talk to me a little bit about what you guys are doing in that regard?
Absolutely. As a matter of fact, we just partnered with one of our mental health professional groups here called RaShall on Fire, in which they've applied for a grant in which they have stress relief kits. So that anytime an officer does a well-being check, a mental health check, a crisis intervention step, that we give out these mental health bags that contain stress relief kits. There's resource information in there. There's gift cards that are in there so that they can get necessities. They also have hand sanitizers, masks, and everything that we can do to increase, reducing and again, flattening that curve at which the rate we overwhelm our health systems. So we're doing these stress relief things since we don't have the opportunity to socially distance. And it's an amazing project in which we put a combination of community resources as well as techniques to help reduce stress. And it's a great partnership, and we're excited about, particularly here with our counseling community and what we can do to help partner and reduce stress not only internally but externally. So we've also then upped our contract with our on-call police psychologists, because there is the fear and worry that are out here on the front lines. What does that look like when you may take this disease home to your family? and making sure that we have all of the interesting, all of the personal protective equipment and protocols in place to keep our officers safe. That includes they can no longer get dressed in the locker room together. Their cars or their vehicles, and they stay with them the entire time so we can protect them. And then we have to decon our vehicles constantly, including assigning transport vehicles that are strictly for COVID patients or for individuals who may be at risk.
Wonderful. We're getting a lot of comments on the side of people excited about these stress relief kits. So maybe we'll circle back to them.
We'll push that out as much as we can. Absolutely.
Yeah. All right. And did you say you're partnering with a specific group on the stress relief groups?
That's correct. It's Brave Souls on Fire, and it's also, and I may get the name wrong here, but it is our Society of Black Mental Health Professionals here in the community, particularly understanding how this disease, this virus is affecting the African-American community at higher rates. And these are populations who are already vulnerable with a lot of other pre-existing conditions that could make them even more vulnerable in the community.
Great, thank you. So another question for you, knowing what you just said about upping the contract with your psychologist and knowing all of your officers on the front lines, are there particular challenges that your officers are coming to you with or that you're hearing through the ranks that they're facing, and what sort of strategies are you thinking about to combat those challenges?
So the first one is stress, and this is already a job that is very stress ridden, and our officers are extremely vulnerable. So I can't wait to hear Ron as he continues to talk about and build on some of these concepts. But they're facing a lot of stress. And I think part of that stress comes from, this is a high stress job anyway, and then add to it the type of calls that we're seeing in our community that are spiking, shots fired calls, those assault calls, as the tensions start to rise in communities where people are in close proximity to each other. They're really scared, and rightfully so, about this virus and this disease and the impact it can have on them. And the communities who are already vulnerable are unsheltered, are unstable housing communities, economic communities, food scarcity and food insecurities. We're going to likely see a continued rise as stress and violence collide, along with fear. And our officers are going to be right in the epicenter of that. And we don't have the same type of personal protective equipment because it is going to the front lines of the healthcare professionals. So first responders are now being put on the back burner because they're not considered that first tier in terms of getting the equipment. So through our police foundation, we raised monies. And again, if you can go on the Charlottesville Police Foundation, we raised monies to give personal kits to each of our officers that contains masks, hand gloves, hand sanitizers, tissues, and soaps that they can carry and dispose with them at all times. So there is a stress relating to how do they protect themselves when they don't have the opportunity to social distance.
Great, thank you. So Chief Brackney, you mentioned Ron's area of expertise, and I want to move to Ron for a minute to talk about obviously there are many cases, Ron, where police are responding to things other than crimes in progress, mental health related calls, for example, and particularly now as stress is rising and people are isolated. Can you tell us more broadly, thinking nationally from your perspective, about the strategies that police can use in dealing with these types of calls?
Absolutely. So realistically, it all starts at dispatch, and that's the number one contact point is through dispatch. And I hope that I can actually address that a little bit later here. But as both chiefs have kind of alluded to, it all comes down to reducing face-to-face contact, and how can we possibly do that? So even if the call goes through dispatch, ends up going out into the officers, a lot of agencies are actually taking advantage of having the officers do a secondary telephonic contact. So they're contacting them to just put themselves at ease, get a little bit more information, and possibly even be able to resolve that over the phone without even having to make contact at the person's home or residence, wherever they're located. They might be able to refer them off to a crisis line if it is a mental health call for service, a 211 line if it is somebody that just needs some behavioral health resources, doesn't know where to reach out to. A lot of the 211s, 311 lines throughout the country now are actually having individuals set up that are specializing in giving information out on COVID-19. So that is a way that people just are looking for information. They reach out to who they've always been taught to reach out to, and that's law enforcement, dispatch. So if the officer can actually push those aside, divert those over to another service, then that's the best way to do it. Another thing that if the officer is trained well enough, they can also start talking about natural supports. So if we send out, say, for example, somebody that's trained at a CIT officer level, to be able to go out and talk to the individual about their natural supports and how to tap into those natural supports, the officer might not have to make any contact whatsoever. If there is in-person contact, then a lot of the officers that we're finding through a survey that CIT International sent out is they've taken the steps to have the individuals step outside, and as well, they're keeping appropriate social distance to actually do their investigation or their intervention, whatever the need is, whatever is required, at a safe distance. Of course, officers are utilizing as much PPE as they possibly can, personal protection equipment. Some agencies are reporting that it is limited. Some agencies are saying that they're okay, that they've got enough that they can use. Some officers are being required to use the same that we're starting to hear throughout the entire country through the medical community as well. Also through that survey, we talked about that transportation is being limited. So if a person needs to be taken into protective custody, if that can actually be resolved through utilizing natural resources, natural support systems, then the transportation is not being done. If there's an order for a pickup order for a mental health evaluation, those are not necessarily being served at this time. Again, trying to reduce the face-to-face contact. If they are actually going to have to do transportation, then there are some extra steps that the officers are taking. That includes additional PPE on the individual as well as the officer. If there is indication that there is COVID-19 symptoms, then they are often transporting those individuals by ambulance to whatever type of receiving center. Any type of citizen contact, and while they are, if they do a transport, it seems that they're following best practices of contacting that receiving center, or if they're doing an arrest, going to jail, they're contacting them and making that connection before they actually present at the door. Another thing that we have found through the survey that we put out was that there's extra steps being taken, that anytime that officers are going out, many agencies are requiring the officer to decontaminate. That means wiping down all of their duty gear, their belts, their hardware, trying to make sure those problems. And if they are doing a transport in their vehicle, then they are also requiring cleaning of the vehicle internally, disinfecting of the vehicle internally after each transportation. So there are some extra steps that are being taken.
Before I move on to dispatch, I'm curious, some people have been asking on the chat about, just this problem you mentioned of people feeling like they're alone and they don't know who to turn to, so they call the police at this time. And I'm just wondering if you mentioned 211 and 311 might be resources in people's communities across the country. Are there other national organizations that you would think police agencies should be leveraging right now to direct people to service if they think others can be more helpful at this time?
So one of the go-tos that we recommend for all the times that I've done training into communities about in forming CIT programmings, one of the resources that I always talk about is crisis lines, either a national crisis line or a local crisis line. The crisis line can serve not only an individual that is in crisis for de-escalation or suicide intervention, but it can actually be a fantastic resource on other behavioral health associations or services that an individual can reach out to. If a person does have a mental health disorder, some of the NAMIs are actually a great place to reach out because they have certified peer specialists as part of their organizations. If there is a community that is following and trying to line up as much of the best practices of a crisis response system, they might have access to a warm line instead of a crisis line, which is another place that those types of individuals can call and just kind of share that their anxieties over the situation and get a little bit of tools or some suggestion on tools that they can utilize to reduce those anxieties.
Great, thank you. You mentioned as you started answering the last question that everything really starts at the point of 911 dispatch. And we know that obviously the 911 dispatch system is very diverse and local across this country, as are police agencies. So each system is going to be operating quite differently. But given how essential it is that that 911 is in this process, can you talk to me a little bit more about specific things that 911 can be doing and dispatch can be doing to better serve communities and also better protect officers?
Absolutely. And it's kind of interesting. I was having this discussion with some colleagues the other day, and we were talking about how things are kind of changing. And believe it or not, there are some things that are changing towards what is starting to become recognized best practices anyway. Through SAMHSA, through the ISMIC, through other organizations, they're identifying some of the best practices. And one of those is triage at dispatch. Instead of somebody just calling in to dispatch and then saying, I need law enforcement because my loved one is in a crisis or that I'm in a crisis, that instead of just automatically sending law enforcement out to that call, that now more and more emergency communication centers are doing a triage, identifying, do we really need law enforcement out there now? And if not, then they're doing a warm handoff to a crisis line to reduce, again, those times that we have to send law enforcement out on a situation and have face-to-face contact. So that's one of the number one things is triage at the 911 when it does come in. And just like I would recommend it for the officers, of course, they can triage that and do a warm handoff to 211 or some other behavioral health service that they have inside their community. As mentioned earlier by Chief Brackney, the expansion of telephonic investigations is being pretty much standardized throughout most of the agencies. They are increasing that. I've heard of a couple of agencies that in fact are taking it to the next step because officers have MDTs that they utilize in their car that they can actually do all of their reports on. They're allowing officers to stay home, to not even have those contacts, to do telephonics at their home residence. So, which is another great way to actually utilize the social distancing. Also, expansion of technology. So, for example, utilizing email to send out investigative forms and to receive those investigative forms back instead of actually having to go out. There's some organizations that are utilizing secure evidence where the individuals can transfer video from a crime in without actually having to send an officer out to pick it up. They can actually transfer that through some sort of secure line to maintain the chain of custody or the chain of evidence. So technology is starting to play a bigger point of this. And if they are sending a call out into the field, then many of and I would hope most, are going to be doing COVID-19 screening and triage questions so that they can find out what's going on out there. And if they come up with positive response to any of the questions, then that information is being passed out to the responders.
Great, thank you. So lots of good strategies, even at the earliest point that we can be using.
Yes.
So Major Ivey, I want to make sure that we have time to also address the health of officers. It's already been touched on by several of the panelists, but I know you lead training specifically around building resilience and surviving secondary trauma. Can you speak a little bit about how this pandemic is impacting officer wellness and what departments should be doing to think about their workforce right now?
Sure. Thank you. I think the chief said it. Stress has got to be the number one right now, and usually what that stress has caused when I talk to people is it's fear. Even though we don't like to say fear, but it's fear. It's fear that unknown. We're no used to dealing with a threat that we can see, and this is something we can't see. And that's scary. We don't know what we're taking home. We don't know what we're being exposed to. So that's the biggest problem right now. is a big one. Officers are very down because officers are being quarantined or they've been exposed. So it means longer shifts or more days off. I have an officer here at a local agency that's on their third of working right now, and that really wears on our systems. The financial impact, many officers and other first responders are really relying upon secondary employment, and right now those jobs are almost non-existent because of the shutdown. But then even if they weren't shut down, they're limited because of the amount of time you have. And then finally, family impact is the other big area I've noticed. If you work the overnight shift, you're usually used to being at home by yourself sleeping, and now all of a sudden you have a house full of kids maybe doing school, or a spouse that's having to work from home while trying to do homeschooling, or a combination of all of those. So you put all those together in an already stressful job. I think it's really starting to hit our folks pretty hard. Things the departments can be doing right now on that fear side is there's two avenues. First thing is work with partners to find the PPE. The PPE for the frontline folks are scarce at times, and especially up front when this epidemic really hit off. But by working with your partners, your retail partners, your foundations, just talking to the community and say, listen, we need thermometers. That's what our department did, and we were inundated with people bringing us the thermometers so we could start taking temperature of our folks when they came into the building. That's huge. Giving the members time off. When they're off, they need to be off. If you are doing court still, you got to find a way to not be doing court. The officers should not have to worry about sleep. They should worry about resting and recharging their batteries and not having to worry about going to court on their days off if possible. If you had scheduled for the officers, that's recommended that maybe you cancel those of all possibility. We need our folks to be recharged if we want them to serve the community the best they can. And then I think the other thing is keeping your folks informed. Our department under Chief Smith has done an outstanding job of letting everybody know what's going on at all times. I mean, we hear from them a minimum of twice a day through our internal communications of this is what's going on, this is what's affected. Here are tips. They're constantly releasing tips. Here's what we're doing. That fear of the unknown for first responders is one of the biggest fears we have because we can't control it. And when we can't control it, that's an awful feeling. So getting that more information out to our folks really has made a big difference, I think.
Thank you so much. And are there any, you mentioned some strategies that you're already using in Kansas City as well as you're hearing about. Are there specific things around kind of surviving secondary trauma that you teach in your course that you think are particularly relevant right now?
Oh yeah, here's a big one. Right? I tell the folks is, and a psychologist, a friend of mine, control what you can control. Don't worry about all these things you cannot control. Find the things you can control and try to improve on those. That gives you a little bit of a feeling of you're back in control of something again. Resources. Provide them to your folks. Provide them to the community. Out of my notes, chaplains for the departments are huge, and in the community, it's a great resource. We've actually partnered with several of our partners, Missouri Coalition for Community Mental Health or Care. I always script their name, but I just call them Missouri Coalition. But they are a major part of our state CIT, and they've made like wellness apps available to everybody. In fact, it's going to get ready to go out nationwide on our CIT news blast, where here is a My Strength wellness app that's normally something being charged for that they're releasing free just so the folks can use it to monitor, give them ideas, to do a lot of self-care. Look for partnerships for childcare. YMCA here has done a great job providing childcare for a lot of these essential workers. We've had other people step up and say, why don't we do like a co-op where we can get people we trust who've been tested, they can watch them on this side, and maybe somebody else can watch them on another night. Any resource that's out there for wellness, mindfulness and meditation through the Pause First Project, that's out there. It's free. ICP has plenty of them. We're going to be putting several of them on the CIT International website. They're out there. If you need to know more, I can listen for the next hour. Just send me an email, and I'll be happy to send out a list I know of.
Great, thank you. So yes, just seconding what Major Ivey said, if people listening in today want access to any additional resources, feel free to email us and we'll send out resources to anyone who requests them. I want to remind people that you are welcome to send in questions. We do have a couple already, but I want to, before we get to the questions from the audience, I just wanted to circle back, hearing about all these changes that are happening, particularly moving things online or to telephonic reporting. I would be curious to hear from each of our panelists about any kind of ideas they have, maybe just identify one or two things they think might be a lasting change based on what they're seeing right now. That would be a positive lasting change in the field. I'll start with Chief Brackney.
These meetings, I think we've now realized you don't have to meet all the time. And in, you know, law enforcement and policing, we always want to have these meetings and then the real work gets done after all of the meetings. So I think now, we are able to, for the first time, really evaluate the necessity of those. And for us here, you're exactly right. We have a lot of our detectives, our entire investigation division is working from home. And that is, I mean, they can now do those kinds of things from home, which means it helps with officer wellness and flexibility when you can work from home and you're not worried about, you know, your child care or some other additional support and resources. And then another thing that I think we will stay is just the way we staff and manpower. We're used to certain types of shifts. We've now moved to squads and virtual roll calls that most of us, you know, as part of our DNA is standing in front of the line and the lineups and you're doing your roll calls. We're now doing these things virtually where we can get that information out to our officers so that you don't have to be someplace at a time to get the information out. You can actually have your officers out in the districts and responding from starting their roll call from home, right? If they have the take-it-home cars, all the things that come across the MDT. So for us, the ability to be much more flexible in our responses will probably stay with us.
Great. Pozo.
Hey, no, those are great answers, RaShall. And I think that, you know, if you look at all 50 states, the laws for citations in lieu of custodial arrest are all over the place. You know, in Vermont, for example, it's mostly citations from the field in lieu of arrest. When I was a precinct commander in New York and a street cop, it was almost always custodial arrest straight to bookings. And so, you know, one of the things that the nation's been struggling to figure out in its alternatives to arrest is what are the roles of these citations? And so we're seeing now, like, policing getting hit by this frying pan where all across the 50 states and the agencies that are paying attention, we're trying a real citation approach to things. And I think that if that works and it remains safe and we don't have bad outcomes, we can see more of a national leveling in the amount of custodial arrests for minor offenses and a lasting increase in citations in lieu of arrest. And the second thing, I love what Chief Brackney touched on, which is, you know, I like to draw this distinction between enforcing social cooperation. And so much of what American police do in cities especially is enforce, you know, is deal with social cooperation, drinking, noise, the flow of vehicular and pedestrian traffic. Should this be a street fair or a protest or a thoroughfare? All the things about dice playing and smoking, you know, these are all things that police are called on to deal with. And in my mind, social distancing is just another form of social cooperation to make bearing use of our social spaces, take overuse. And what we've relied upon in the past is a lot of enforcement of these rules. I think the opportunity here is to see how far we can get by brokering these rules instead of enforcing them. That's something Chief Brackney touched on. And the last thing I'll say, I know Leah has heard me say this before, but health has what are called in the law police powers. If you look at public health's authority, it's a police authority, but it's not a legal authority as an end in itself. It's the authority to achieve a public health. Maybe one of the lasting effects of policing as we broker cooperation instead of enforce it is to realize that we're in the same boat of using laws to empower us to achieve public safety, not to enforce them as ends in themselves. So you'll never hear me call myself former. You'll never hear me call the folks in this room law enforcement. I call you guys and gals police officers. And one of the many things, and I think that COVID-19 can do a lot to remind us of that.
Looks like Ron, you want to add something?
Yeah, I was just going to say that I think that utilization of community resources at an earlier level, I think, is going to become even more norm. It's going to be incorporated into more emergency communication centers. We already seen that growth. We already saw that starting to expand, but this has given all of the ECCs an opportunity to really see the power of it and how they can actually divert at a much quicker level than sending it out to the field.
Yeah, absolutely.
A big thing for me is I'd love to see, and we've already seen over the last couple of years starting, but the expansion of the telehealth, I think, is really going to take off with this. That is so important, not only for how we respond to calls, especially in the CIT realm, having that availability to where we can put somebody with a trained professional, but even for our employees to where they just need someone to talk to. They don't want to go to the counselor's office. They don't want to use EAP. So here's a telehealth way you could do it. And we've done that several times already through a lot of our partner organizations. Are providing trained professional care who are trained with first responders already giving us that as an option. So I think that'll expand even more, and I'm excited to see that.
Great. Thank you. So I'm going to turn now to some questions that we've gotten from members who are listening. I'll start with a question for, I think Chief Brackney, you might be able to answer this best. So this is a question about how police officers and agencies are working with community corrections, specifically probation and parole. So for example, if you encounter a person who is on probation or parole that may be in violation of that order, how are you working with corrections agents, community corrections agencies right now?
So thank you. So a couple of things just to build on what Brandon indicated when we're talking about what does it look like in releasing individuals from either our jails or our correction institutions, our prisons and penitentiaries. This has to be a collective effort for each and every one of us. And I think for the first time, it's making us really examine what we hold to be true in terms of what our social responsibility is around punishment and always exacting retribution, right? It always seems like there's this retribution part that we put law enforcement components of our policing profession on the forefront of what we do. And that's the thing. So for us, we are working with probation and parole to do a matrix of what those type of violations and referrals would then result in. So if at this point, it's pretty easy in terms of these house arrest and the electronic monitoring systems that we now currently have into place. So we formed a coalition between the jails, the Commonwealth's attorneys here, our public defender's office as well. So don't leave that component out, which we often forget about, as well as our victim witness advocates and our policing agencies to look at what those violations may look like, and is there a necessity to address them if there is no public harm to the community at this point in time. So you can push those back, but there's a group of us, and we've included the ACLU in this group. I know we don't often want to hear that when we're talking policing, but we're looking at those advocates and creating coalitions for the first time to look at community health and community public safety. Because what we're actually looking for is, I use this word a lot, a co-production of public safety. And that requires more than just the policing professionals to do that. So we are incorporating probation, parole, Commonwealth's attorneys, ACLUs, public defender's office, as well as our detectives who are liaisons. And we are using some of our community partners here, like those who do our health and human services, as we look at all of these cases and how it may impact the community. And are we better served at possibly getting some other social service support there versus now reintroducing them into a jail population where we see some of the most concentrated cases are occurring in the Cook County Jail compared to the rest of the United States. So I think there's great opportunities here for us to look at our policing profession and how we leverage probation and parole differently, and what are those outcomes we're attempting to get when we're looking for compliance once they are reintroduced in to society. Hopefully that answered the question.
Yeah, I think that's a great answer, really informative, and also just another example of how this moment may be creating some new and lasting partnerships that change the system overall in the long run for the better. So it's great to hear how it's working for you guys. Another question coming in is, we've talked a lot about building and leveraging partnerships with the community. And there's a question that I'm happy to have anyone answer. What, if anything, can the private sector do right now to support and promote public health and public safety outcomes? Any ideas from our panelists on this one?
So Jennifer Wood is a professor at Temple University who has a paper out maybe a few months ago, back in the good old days, called, I'm subtitling it, but I'm paraphrasing it, but like private security and public health. And so this is not a comprehensive answer to your question, but you know, we're dealing with a lot of instances where in malls or, you know, buildings where private security has a role in determining who gets in and who gets out, who gets the police called on them, whether they want charges pressed against a person or not. And so I think that a lot of the questions that we're wrestling with here about how sworn uniformed officers working for the government should treat people in the interest of public health and public safety also apply to big corporations and facilities that employ private security as well. So that's not about like private sector collaboration or support, but that is something to wrestle with. When you look at a lot of profiling by proxy or other things, a lot of times it's private security taking action, and I think that's something to deal with. And like I said, Jennifer Wood, maybe I'll look up the paper and email it out, but it has an excellent paper about that of late.
Great, thank you. Another question is that just came in is an interesting one about whether any of you in working in your police departments, maybe Major Ivey or Chief Brackney can answer this, whether you're able to cooperate with your health system to know where positive cases are rising, what specific geographic locations, and how to use that information to better protect your staff. Oh, Chief Brackney, you're on mute.
Is that better?
That's better.
Thank you. Yes, we actually used a Department of Justice opinion because we were not getting that information prior due to HIPAA violations. They were saying that there were HIPAA violations. So what we did is worked with our health, the Virginia Department of Health, and our hospital systems here, UVA hospital system, as well as Sentara Martha Jefferson. And all we were asking for is, we didn't necessarily need a diagnosis, but that we would receive private secure across our MDT information that would then tell us that the personal protective equipment was mandatory. And when we got that note in there that personal protective equipment was mandatory, that the officers knew that there was a health risk there. And it's the same kind of health notifications we should have been getting, and we've noticed that, or we now know that we weren't getting previously, that there are people in your communities who are being quarantined and self-isolating for things like tuberculosis or measles, and they were not getting out to our first responders as well. So we're using this now to go across platforms. But we had to advocate for it because the only persons in your states are your attorney generals who could force that information to be released. And that was the next step that we were going to take if we did not get our health agencies to help us relent and to give that information out voluntarily.
Major Ivey, are you able to do similar things in Kansas City?
We are, and I can't really go much into it because I don't know the ins and outs, but I know it's very similar to what the chief was talking about on many of those avenues on the information that's provided and how it's provided.
Great. Just trying to get through all these questions. So we have a few people wondering, Chief Brackney, if you can repeat what is in the stress kits. And if you don't have it now, I'll compile the information and send it out.
I am typing that in as we speak, but I'll make sure we get it out. So literally there's grocery gift cards in the receipts. You can't get alcohol, tobacco, or firearms. And in Virginia, I won't say anything about the desire to purchase firearms that we're seeing. So you can get necessities. There are also masks. They put in healthy snacks, herbal teas that help reduce your stress, anti-stress gadgets like those fidgety widgety things that young folks are doing. There's gloves, anti-bacterial and hand sanitizers. It's a full list of printed resource materials that people have available to them free online, where you can get free telehealth and mental health resources. There's a health and wellness component that exercise and how we can do exercising, how you can get in. You can get out for health and exercise, get takeout, stay in for, so that we can, or stay at home so we can go to work. There's information like that in there. I'm reading it out. Also, they have adult coloring books, things like to help journal and keep a reflective component to how you're feeling during this crisis. There are lots of interesting things in this kit that they're putting together, things I would have never thought of. So I was really honored when Brave Souls on Fire, who is a mental health advocacy agency here in Charlottesville, asked us to partner with them and asked we be the conduit to get them out into the community. So there's things to deal with loneliness and what occurs when you're experiencing loneliness during this time and how to stay connected with community. So it is an extremely amazing kit and I'm excited about it.
Great. Thank you. Yeah, just another great example of some of the police community partnerships that can be strengthened right now. So thank you for that. And what a great kit. I want one. I'm curious if any of you can answer this question next. It's a specific question to ask on if you can touch on youth and what some options for agencies are doing to interact with youth specifically. And Ron, a question specifically for you about whether there are resources from CIT International specific to youth. Oh, you're on mute.
Yeah, there I go. So basically, we don't have anything specific right now on the lines of what involving the COVID-19. That is something that we are expanding on our site in the lines of things that can be done for different types of disciplines as well as for different types of populations. So we are developing that right now. Of course, CIT does have a youth component to it. And so there is CIT for youth in many communities that if somebody is in need and they need to reach out to law enforcement, they can't find any other resource that we could tap into the CIT for youth.
Leah, also, it's a good question because I happen to oversee our youth programs right now. And one of the unfortunate things that came about is we actually had to shut down our PAL and our DARE programs here because of the pandemic. But one of the things the officers have been doing in the SROs as well is they've been keeping in touch with the kids. They do Zoom meetings with them. They do projects over videos, anything just so the youth can see that, hey, the police still care for you. We're not there on a daily basis, unfortunately, because of what's going on, but we're here where we can assist you. And it kind of goes into the community partnership as well as officer wellness, is giving the officers a chance to serve. I mean, that's why we even became police officers, most of us in the first place. And it's been hard just answering calls and not really getting out and go to do the community things that we enjoy doing. So many of our officers, our FOPs, many of the command staff are going around getting meals and then delivering it for the families that don't have that food available to them. And we just do it by dropping it off from the door, calling them up, say it's outside. We take off, we keep our social distance. And with great community partners, we were able to provide boxes that have food for families of 4 that'll last them a week. So it's things like that, that it's a great partnership. At the same time, it's helping the officer wellness by letting them become involved and stay involved with the community. And then it's helping the youth because unfortunately food is coming from the schools for many of our families. So with the schools shut down, that's one of the scary things.
Yeah. Thank you for that additional information. Unfortunately, we are out of time. I just want to say a final thank you to all of our panelists today who provided such great information. If anyone listening in today has additional questions or wants resources that were mentioned, feel free to reach out to me via email. It's lpope@vera.org, and I'll be sure to pass along any of the resources that were mentioned or answer other questions that may have arisen. Thank you again, everyone, and take care. Be safe.
Thank you for having us. Everyone stay healthy, stay safe.
Yes.